In this video, I'm going to show you some of the most expensive tinnitus treatments in the world. Seriously, I did an analysis on over $100,000 worth of tinnitus treatments. One of them even costing $50,000, and I'm going to be trying them on and visiting other doctors to show you why they're so expensive, starting with this $50 tinnitus treatment. It's called the Oasis Sound Machine. And for around 50 bucks, you can get one of these. It's a high quality sound therapy system. It might just look like a Bluetooth speaker, but don't let that fool you. It comes preloaded with 20 different sounds. I'm going to turn it on right now and take a listen. How it works is on the machine, you can adjust the type of sound as well as the volume. In addition, there is a Bluetooth streaming mode to connect it to your phone. What I love about the Oasis Sound Machine is that it has an internal computer chip that stores the sound, so it doesn't rely on Bluetooth. And in tinnitus retraining therapy, when we rely on sound therapy, we know that consistent sound enrichment is so important. We don't want to put our attention to the sound when it gets interrupted with notifications or text messages from our phone. Therefore, having this separate sound machine is really helpful for my patients. You see, in my testing, this guy can really help with concentration and attention during the day despite having tinnitus going on in your ears or your head. And it can also help you fall asleep by keeping it by your bedside table at night. So I believe this is a great investment. All right, now for just $25 more than the Oasis Sound Machine, you can try the Cortexi eardrops. Now guys, what this company is trying to make you believe that tinnitus is some kind of nutritional deficiency and that if you use basic herbs, you can restore your hearing. It also suggests that putting drops and liquid in the ear canal is going to get to the root cause of your problem, but never believe that because it's very rare that earwax or something in the ear canal like an outer ear infection can be causing your tinnitus. To be honest, this kind of stuff gets me really angry. I hate to see companies who take advantage of our community, who are desperate and looking for help for their tinnitus. I would definitely save your money and avoid buying any eardrops for tinnitus unless it's recommended by your ENT doctor. Next up, we have a $1,000 tinnitus treatment that has somewhat mixed results. This is called the Neosensory. It's available to rent for $250 a month for 4 months, which puts you at a price point of around $1,000. The components of the wristband include a vibratory piece that looks like a watch face that sits on top of your wrist and a rubber band that wraps around that you can attach to your wrist. So it looks like a Fitbit or a wristwatch. Now how it works is you have an app that plays ascending and descending tones, and at the same time, you're in a quiet place and you're feeling these vibrations on your wrist. That might sound appealing, but trust me guys, the evidence out there is very weak that the Neosensory does anything for tinnitus. They may have put some strong numbers on their website, but from using this with our patients at Treble Health a few years ago, we found that it was essentially worthless. It seemed to work best for people who wanted an extra tool that could potentially help them calm down during a tinnitus spike. If you have limited time and money, I would definitely skip Neosensory, but if you're one of those lucky few who can spend $1,000 on a whim, it's not going to hurt you, there's no negative side effects here, and you might potentially see some benefit. Next up, we have cognitive behavioral therapy, a $3,000 tinnitus treatment. Okay, the price on this one was a little tricky to come up with because it depends on your insurance and which therapist you go to, but even with a copay, CBT might cost someone thousands of dollars over the course of their therapy sessions. Is that investment worth it when you're trying to reduce tinnitus? Now, the first thing to point out here is the effectiveness of CBT on reducing tinnitus is only as effective as the therapist or psychologist that you work with and their knowledge on tinnitus. There are particular nuances to tinnitus that are very important for you to work with someone who knows what's going on rather than just working on anxiety, stress, your emotions, or sleep. It might seem a little odd to even recommend a kind of therapy for tinnitus relief and treatment, but the truth is that stress and anxiety about our tinnitus can really affect the ringing in our ears. Put simply, if you're in a panic about your ear ringing, or even just really bummed out, that can make it worse. CBT has lots of great techniques that have people manage the emotions surrounding their tinnitus, and in turn that makes their tinnitus better. We see this with our patients where at Treble Health, when we use CBT techniques, the fundamentals of this approach, we're changing the response or reaction to tinnitus, and over time that helps retrain the brain by impressing upon the limbic system, the core emotional network of our brain, to categorize tinnitus as more of a neutral signal rather than a threat or a danger or something that could harm us. And that's not just a conscious mind process. What we're really doing is changing the subconscious processes, which that is often the source of tinnitus for most people, in that subconscious auditory brain. That's what we're trying to influence with treatments like sound therapy, like tinnitus retraining therapy, like cognitive behavioral therapy. So if you're a little hesitant about the commitment or cost with CBT, I would still say you should either try it with a therapist who specializes in tinnitus, or consider working with an audiologist who understands the fundamentals of cognitive behavioral therapy for tinnitus. Next up, we have a $4,000 tinnitus treatment called Tinnitus Retraining Therapy. And I want to add an important bias here, is that as an audiologist who specializes in this retraining therapy, I've chosen to use this the most with my patients and recommend it often because based on my understanding of the research and going deep into every study that comes out about a new tinnitus treatment, the TRT, Tinnitus Retraining Therapy method, is the premier approach, especially when you're working with an audiologist who understands how to use it. I was trained with the founder of Tinnitus Retraining Therapy. He's my direct mentor, and everyone at our team at Treble Health in our telehealth program is an expert in this method. The core approach of TRT is to have a combination of sound therapy treatment plus one-on-one sessions with a tinnitus expert trained in the therapy method. And how it works is it retrains your brain to reduce the perception of tinnitus over time. So for most people, that means the awareness or the impact of tinnitus can decrease in the first weeks and months, and oftentimes the volume of tinnitus, the loudness level, the intensity of it decreases in the months, sometimes pushing up to around 1 year. Now, guys, what a lot of people don't know is that we have the leading telehealth service for tinnitus. You can click a few buttons here and schedule a consultation with a specialist on our team within 24 hours. All you have to do is click the link on the screen right here, and you'll be guided towards scheduling your free consultation with Treble Health. I really encourage you to check it out. Now let's get on to the next, more expensive tinnitus treatments. Next up, we have the $5,000 tinnitus treatment. This is the Linear product by Neuromod. This might seem a little weird, but here's how this device works. You put it on your tongue with a piece that goes right in your mouth, and at the same time, you have headphones that go over your ears. You start up the device, and for about 1 hour per day, you sit there in silence with these headphones, and you have the tongue tip in your mouth. It uses bimodal stimulation, so there's some vibrations happening on your tongue. Almost feels like Pop Rocks, the candy, if you're familiar with that. And then you have these headphones that go over your ears and you hear different kind of sounds going on. That's not sound therapy. That is just sound playing through the headphones that's used for the bimodal stimulation. So here's the pros and cons. The research behind it was published and it showed a minimal amount of significant benefits. Linear's research group claims that 91% of users had a reduction in tinnitus. But at the same time, a nonprofit group, Tinnitus Hub, found that only 48% of surveyed Linear users showed a significant reduction in tinnitus. And I've seen it help some people. I've also seen some people's tinnitus gets worse from it. But to be honest, I've seen for a lot of people, it doesn't do much for them. And there's no trial period or satisfaction guarantee, which means there's a costly risk if it doesn't work for you. So I'd personally be cautious about jumping into Linear before doing your research, and you can certainly use it in addition to other treatments like CBT, cognitive behavioral therapy, or TRT, tinnitus retraining therapy. So for the price tag, I do think there's much better options out there. Now let's talk about a $6,000 tinnitus treatment, hearing devices, and for this, I'll be joining Dr. Andrew Resnick, audiologist in Manhattan, New York City. Okay, don't skip this one. It's probably more relevant than you think. So many people I talk to say, I have a tinnitus problem, not a hearing problem. But sometimes, and you might not even notice, a hearing problem can be related to the treatment to your tinnitus. It's one of the most common causes of tinnitus, actually, to have a high-pitch hearing loss. We call that the cochlear subtype of tinnitus.
So, Dr. Resnick, if someone contacts your clinic with tinnitus, with a problem related to their ears ringing, what's the typical flow that you bring them through during consultation and an appointment?
Right. We take a very extensive case history regarding their hearing, sound sensitivity, tinnitus, triggers for tinnitus, and just the history and timeline of their tinnitus and hearing loss if they have hearing loss. We use some questionnaires to assess their own self-perception of their tinnitus and their hearing. And then we do a full comprehensive audiological evaluation, which is your hearing test, unless they've had that done elsewhere recently. But very often, people with tinnitus are also candidates for hearing aids, and they can be very, very helpful for tinnitus. Often, as part of a tinnitus evaluation, we'll do what's called frequency or pitch matching, try to get a sense of the frequency at which the tinnitus is occurring. And based on that, we might make certain adjustments to the hearing aid programming. But very often, just the amplification for their hearing loss is enough to provide significant relief from their tinnitus.
All right, next up I want to show you Lyric. This is a tinnitus treatment that for both ears together costs $3,700 per year.
Lyric is a very unique type of hearing aid. It's what we sometimes call an extended wear hearing device. It's the only hearing aid that exists that is designed to stay in the wearer's ear for 24 hours a day, 7 days a week. Well, because it's in the ear 24 hours a day, there's tinnitus relief 24 hours a day. We see many people who do get help for their tinnitus from hearing aids, but with traditional hearing aids, they have to take them out when they go to sleep. And the quiet nighttime is already a time when many people have exacerbated tinnitus. But if you're getting help from hearing aids, then when you take them out, that contrast can make the tinnitus seem even worse at night. With Lyric, because it's in the ear all the time, even when you're sleeping, people really find that they're getting this 24-hour tinnitus relief.
All right, next up we have a $10,000 tinnitus treatment. This is called transcranial magnetic stimulation, or TMS. And it uses magnetic fields to stimulate your brain in the auditory regions that may be related to your tinnitus. And while it's being studied a lot for depression, it has shown some benefits for tinnitus. It's something often done by a psychiatrist, but also sometimes other doctors and medical professionals can provide it. It's a super pricey treatment, and as more evidence comes out, we'll have a better picture of who TMS could potentially help. The real question is, should you do it? Well, transcranial magnetic stimulation, or TMS, isn't something that most patients would start using right away for their tinnitus. It's something that would only come after they put serious commitment and time into the more foundational approach of tinnitus retraining therapy, potentially also cognitive behavioral therapy. And if the results that we're seeing there don't match what we'd expect, if you're in that small minority of people who aren't getting better, then there might be something underlying that could be impacting the system here for how your brain is able to reduce tinnitus. And it could be related to a severe depression. So if you have a history of mental disorder, or if you're experiencing serious depressive symptoms, that's something to check out with a mental health professional, because more depression-focused treatments could be used, and in those cases where depression gets better, you'll often find that tinnitus gets better because of it. Guys, next up we have a stem cell transplant for the ears, which costs about $12,000. This one is super experimental, and not a lot of places are doing it. To be honest, I'm a little torn. Stem cell transplants are being researched to restore hearing. The infusion or injection might actually help the damaged hair cells in the inner ear that cause deafness or hearing loss. That obviously sounds really exciting, but here are my concerns. A lot of times, tinnitus is not only caused by hearing loss. It's very common for people to have a high-pitched hearing loss. They go to the ENT doctor and they get a hearing test by the audiologist, and they're told, well, your tinnitus is caused by hearing loss. Now that sounds logical, but you likely had this slow progressive hearing loss over time, and then the tinnitus might have come up a lot sooner. And oftentimes patients don't even perceive a problem with hearing, they just have a tinnitus problem. So in my experience, just focusing on the cochlea, on the hearing organ, will only get us so far. We know that when we treat hearing loss, yes, that has an improvement for tinnitus, but if someone's going through other significant subtypes of the tinnitus cause, like the central subtype or the somatic subtype, then it's very common to experience limited benefit from a treatment. And then you might think, oh, there's nothing else that can be done for my tinnitus, which I would respond, no, we need to identify what are the true root causes that are at play here and work on those. So A comprehensive protocol and working with a specialist like me would take that into account. But if you just focus on the cochlea like these stem cells are doing, I believe you're going to get limited results. And with such an expensive surgery like this, because I had a patient who did it, they took cells from his stomach and then they put them in his ear. He didn't experience any benefit to his tinnitus, but he had to go through a surgery. He had a serious recovery period, and he was pretty upset and disappointed, which didn't help his mental health in his tinnitus treatment recovery. Guys, I'm really excited to show you this one. This is the most expensive tinnitus treatment that I've ever found. This is a $50,000 cochlear implant. The average cost of cochlear implants can range from $30,000 to $50,000 without insurance. However, most major insurances and federal insurance programs provide coverage for cochlear implants to treat severe hearing loss. This one is really, really cool. It blows my mind that technology like this even exists. If you've been told that there's not much you can do for tinnitus and you don't know what to do to help with the incessant ringing or sounds in your ears or your head, I want you to know that there's help available. If you're wondering which option is the best for your specific case, talk to a world-class tinnitus specialist and audiologist about it right here at Treble Health. We can recommend treatments that are tailored to your specific tinnitus. Just click the link on the screen right now where you can schedule the consultation and speak with a specialist from my team to see what's available for you. Remember, there's always hope, and you can take the next baby step to do something this week that can help you better manage your tinnitus. The goal here is a tinnitus treatment, so click the link on the screen to learn which solutions are available for you today.